Have you ever wondered why simple, inexpensive health solutions are rarely mentioned? In your kitchen, there may be a secret that almost no one wants you to know. Not because it doesn't work, but because it doesn't make money. It doesn't make money for pharmaceutical corporations. It doesn't have a place in expensive advertising campaigns. And so it's gradually being forgotten on purpose. Baking soda, an ingredient that seems to be used only for baking, deodorizing, or cleaning. However, if you know what modern science is starting to confirm about it, you will never look at baking soda with the same eyes again. From aiding digestion, reducing inflammation, improving sleep, to supporting kidney function and even inflammatory reactions in joints. That little white powder is showing power beyond imagination. And here's the part that really gets you thinking. If just one glass of water mixed with baking soda every night can help millions of people get rid of the ailments that plague them every night, like reflux, insomnia, joint pain, why isn't it common knowledge? The truth is, no one has a financial incentive to tell you about something simple that works. But today we're going to do it. In this video, you'll not only learn about the surprising benefits of baking soda, but you'll also learn how to use it safely, wisely, and effectively. And remember, the best part is at the end, where we'll reveal the right mix, the right dosage, and how to make this little habit part of your natural recovery journey. Don't look away. The difference is in how you use it, and it can change your health. To understand why baking soda can have such profound health benefits, you first need to understand how our bodies function every day and the mysterious role this alkaline substance plays in your biological system. Baking soda, or more accurately sodium bicarbonate, is a naturally occurring alkaline substance. When it enters the body, it does more than just neutralize stomach acid, as many people think. It actually participates in a biological pH buffer system, helping to balance the acidity and alkalinity of blood, urine, and tissues. This is an important foundation for the stability of a wide range of processes, from metabolism and enzyme activity to the control of inflammation and immune cell function. Think of your body as an ecological lake. If the environment becomes too acidic due to stress, a diet high in red meat, sugar, alcohol, or even sleep deprivation, the ecosystem becomes unbalanced, leading to inflammation, pain, fatigue, and even chronic disease. Baking soda is like a quick fix, temporarily helping the body return its pH to safe level. Especially at night, when the body enters a recovery state, properly supplementing bicarbonate can help optimize this process, from reducing oxidative stress, reducing inflammation, to facilitating deeper sleep and muscle recovery. It's no longer a folk remedy, it's a biological mechanism, and it's worth your attention. Reduce acid reflux and heartburn at night. You lie down in bed, the lights are off, but the burning sensation in your chest keeps coming back. It's more than just an uncomfortable feeling. It's a disruption to sleep, a recurring night of fatigue. Acid reflux and heartburn are the result of stomach acid flowing back into the esophagus, often due to an ineffective lower esophageal sphincter. And at night is when the body is most vulnerable. Baking soda, with its strong alkalinity, acts as a natural neutralizer. When taken in small amounts before bed, it can reduce excess acid in the stomach, helping to quickly relieve the burning sensation. A study published in BMJ Open Gastroenterology, 2022, found that drinking bicarbonate-rich mineral water significantly improved reflux symptoms compared to a placebo group. While not a long-term treatment for GERD, reflux disease, with the right dosage and frequency, it's a great nighttime support solution when you need peace the most. Reduces muscle soreness after exercise, promotes recovery. You've just had a tough gym session, or simply a day of more movement than usual. When night falls, the dull, heavy feeling of muscle pain prevents you from fully relaxing. This is the result of muscle acidosis, where hydrogen ions accumulate after you exercise vigorously, making the muscle environment acidic, causing fatigue and pain. Baking soda, a powerful pH buffer, when taken at the right time before bed, helps increase the alkalinity of the blood, allowing the body to process excess acid. A study published in Frontiers in Nutrition, 2019 found that supplementing with sodium bicarbonate can improve recovery after intense exercise and even improve performance for the next workout. This isn't just a fitness tip, it's a recovery step you can do in your bedroom with just a small glass of water. 3. Supports kidney function, especially for people at risk of chronic kidney disease. In the dark of night, As the body enters its repair cycle, internal organs also work to recover. For people living with chronic kidney disease, CKD, this period is an opportunity to intervene and slow the damage. One of the common problems in people with CKD is metabolic acidosis, a condition in which the body builds up acid because the kidneys can't filter it effectively. Supplementing with baking soda, in the form of sodium bicarbonate, has been shown to help correct acidosis, thereby supporting kidney function and slowing its decline. According to a 2021 meta-analysis published in Frontiers in Pharmacology, patients who took baking soda as prescribed had significant improvements in their estimated glomerular filtration rate, eGFR, an important indicator of kidney health. At night, when metabolism slows down and the cleansing process is active, taking baking soda in moderation can significantly support kidney health. However, this should always be done under medical supervision. 4. Helps treat and reduce the risk of gout attacks. Gout attacks often come on suddenly and often at night. The big toe may feel swollen, hot and red, as if it were on fire. Gout is caused by a buildup of uric acid in the blood, which crystallizes and sticks to the joints. Baking soda, which alkalizes urine, may help increase the solubility of uric acid, helping the body eliminate it through urination. A new study published in 2024 in the British Journal of Hospital Medicine found that taking sodium bicarbonate in combination with the drug benzbromarone reduced uric acid levels and slowed the progression of kidney damage in gout patients. By drinking a glass of baking soda before bed, when inflammatory reactions are likely to flare up, you can not only reduce the risk of a flare-up, but also help control symptoms naturally and effectively. Balance your body's pH, support immunity, and reduce inflammation. Did you know that even a small change in your blood pH can affect a wide range of bodily functions? Every day through diet, stress, and lifestyle, we are loading ourselves with many acidifying factors. Red meat, coffee, fried foods, prolonged stress, all contribute to an imbalance in the internal environment. A study published in the Journal of Nutritional Biochemistry 2024 showed that drinking bicarbonate-rich mineral water for 2 weeks significantly increased urine pH and reduced net acid excretion, a sign that the body's internal environment is gradually becoming alkaline. Why is this important? Because the body functions optimally in a slightly alkaline environment. Immunity, enzyme activity, muscle function, all depend on this factor. A glass of baking soda every night is no substitute for a healthy lifestyle, but it can be a simple tool to help restore biological balance after a long, tiring day. Reduce the discomfort of urinary tract infections, UTIs at night. The painful burning sensation when urinating due to a urinary tract infection, UTI, can become more intense. This is because the bacteria that cause UTIs often thrive in acidic environments, and this is what causes the uncomfortable burning sensation. Baking soda again works by increasing the pH of urine, creating a less favorable environment for bacteria to grow. A study published in the International Urogynecology Journal found that women with an acidic urine pH, average 5.3, who used baking soda for 4 weeks, increased their pH to 7.2, while significantly reducing symptoms such as frequent urination, nocturia, and urgency. However, it is important to use it only in mild cases or as an adjunct to medical treatment. It should not replace antibiotics or intensive treatment if the condition persists or recurs frequently. These benefits do not come from a miracle. They come from a correct understanding of biological mechanisms and the persistence of small habits every day. Using baking soda properly is not about an instant cure, but about giving your body a chance to restore, rebalance, and heal itself. And all deep healing often begins with sleep. Quality sleep, undisturbed by pain, burning, reflux, or inflammation. Just a small glass of water at the right time can make a difference. When it comes to cancer, most of us immediately think of chemotherapy, radiation therapy, or other expensive and harsh treatments. But few people realize that one of the important environmental factors that affects the growth of cancer cells is the pH, the acidity of the environment surrounding the tumor. And this is where baking soda begins to enter controversial scientific debates. Recent studies, especially the work published in Frontiers in Oncology 2024, have opened up a different direction. Researchers observed that the use of sodium bicarbonate can help reduce the acidity in the tumor microenvironment, thereby inhibiting the growth and metastasis of cancer cells. In a mouse model of the disease, the group that used baking soda solution had a higher survival rate, and the amount of abdominal fluid caused by cancer was significantly reduced. It's important to stress, however, this isn't a miracle cure, and certainly not a replacement for conventional medical treatment. But it does show that, by interfering with the cancer cell's environment, baking soda could potentially play a supportive role if further research is done and used properly under medical supervision. Maria, 52, lives in a quiet town in northern Italy. Every night, she struggles with chronic pain in her joints, including her hands and knees, a result of rheumatoid arthritis, which she has suffered from for more than 8 years. Every morning when she wakes up, simple tasks like holding a hand or a glass of water become a challenge. But then she starts a small habit. Mix half a teaspoon of baking soda in warm water and drink it in the evening, about an hour after dinner. She didn't expect miracles, but after a few weeks, Maria noticed that her night pain gradually decreased. Her sleep was deeper. Her joints were no longer dry every morning. What happened? Research from the Journal of Immunology explains that regular sodium bicarbonate supplementation can directly affect the immune system, changing the activity of macrophages from an inflammatory state, M1, to an anti-inflammatory state, M2. Simply put, it helps the immune system calm down instead of attacking healthy tissue. Maria's story is not uncommon, and while baking soda is not a cure for RA, sometimes a small, well-intentioned action can make a big difference in your journey with the disease. Although baking soda is a simple ingredient, using it properly requires understanding and caution, because the boundary between a supportive dose and a harmful dose is sometimes just a small spoon. The optimal time to use it is about 1 to 2 hours after dinner, when the stomach is stable and no longer has strong digestive activity. Drinking at this time helps limit the gas reaction caused by baking soda reacting with acid in the stomach, while helping the body absorb it more effectively before going to sleep. The safe dose recommended by experts is half teaspoon, equivalent to about 2.5 gin completely dissolved in 1 glass of water, 200-250 ml. Use cold or slightly warm water, not boiling hot water. Stir well and drink slowly. Do not drink too quickly to avoid bloating and flatulence. The appropriate frequency of use for healthy people is 2-3 times per week. Should not be used continuously every day for a long time without a doctor's prescription. Prolonged use can increase the risk of sodium accumulation, causing electrolyte imbalance or blood alkalinity. Remember, baking soda is not a miracle cure, but if used properly, it can become a gentle, effective, and safe support in your healthcare journey every night. While baking soda can have many benefits, it is not suitable for everyone. For those living with high blood pressure, heart disease, or kidney failure, the sodium in baking soda can make the condition worse. Just half a teaspoon contains a significant amount of sodium, enough to cause water retention, increase blood pressure, or disrupt electrolyte balance. Pregnant women, especially in the 3rd trimester, should also avoid using it without the consent of their doctor. Changing blood pH and water retention can negatively affect pregnancy. Those taking diuretics, corticosteroids, or antacids should also be cautious, as baking soda can interact and cause side effects. Most importantly, listen to your body. Simple, natural does not mean safe for everyone. Always consult a professional before starting any new habit, no matter how harmless it may seem.